Hello everyone and welcome back to VitalHer. I'm so glad you decided to watch this video today. My name is Dr. Mary Williams and I'm a board-certified gynecologist with over 15 years of experience helping women navigate their most intimate health concerns. I've been practicing here in the States and I can tell you that what we're going to discuss today is one of the most common yet under-talked issues I see in my practice. I decided to create this video because I've been seeing more and more women in their 40s, 50s, and beyond coming into my office feeling confused, frustrated, and honestly, a bit embarrassed about changes they're experiencing with vaginal dryness and discomfort during intimacy. Many of them whisper to me, "Doctor, I don't know what's wrong with me. My body feels so different." The truth is, there's absolutely nothing wrong with you. What you're experiencing is a completely natural part of aging that affects up to 50% of postmenopausal women in the United States, according to recent medical studies. Before we dive deep into this topic, I'd love to ask you a huge favor. If you find this information helpful, please hit that subscribe button, leave a comment below sharing your thoughts, and don't forget to share this video with other women in your life. Your support means everything to me and helps me continue creating this essential content about women's intimate health. Today, we're going to explore this in 2 comprehensive chapters. First, we'll understand exactly what's happening in your body during menopause and why these changes occur, and then we'll discuss practical solutions and treatments that can truly make a difference in your quality of life. Let's start by talking about what's really happening inside your body during menopause, because understanding the why is crucial to addressing the what now. When I explain this to my patients, I often use the analogy of a garden. Think of estrogen as the water that keeps your vaginal tissues healthy, plump, and well-functioning. During your reproductive years, your ovaries are like automatic sprinkler systems, consistently providing that hormonal water to keep everything flourishing. But as you approach menopause, typically between ages 45 and 55 for most American women, your ovaries gradually reduce estrogen production. By the time you're officially in menopause, which is defined as 12 months without a menstrual period, your estrogen levels have dropped by about 90% from their peak reproductive levels. Now here's what many women don't realize. Your vaginal tissues are incredibly estrogen sensitive. These tissues have estrogen receptors that, when properly stimulated, maintain the vagina's natural elasticity, thickness, and ability to produce lubrication. Without adequate estrogen, several changes begin to occur, and I see this pattern in my practice almost daily. Let me share a story that really illustrates this. Just last month, I had a patient, let's call her Sarah, who came in feeling devastated. She was 52, had been married for 25 years, and told me through tears, "Dr. Williams, I feel like my body is betraying me. Intimacy with my husband has become painful, and I'm starting to avoid it completely. I feel like I'm failing as a wife." Sarah's experience is heartbreakingly common, and I want every woman watching to know that you are not failing anyone. Your body is simply going through a natural biological process that requires some attention and care. The medical term for what Sarah was experiencing is vulvovaginal atrophy, or genitourinary syndrome of menopause. But let's break this down into language that makes sense. First, the vaginal walls become thinner. During your reproductive years, these walls are thick, with multiple layers of cells that create a cushiony, protective environment. As estrogen decreases, these walls can become up to 50% thinner, making them more fragile and prone to irritation. Second, blood flow to the vaginal area decreases. This reduced circulation means less natural moisture and slower healing when minor irritations do occur. It's like the difference between a well-watered plant and one that's been left dry. The tissues simply don't have the same resilience. Third, and this is crucial, the vagina's natural lubrication process changes dramatically. Normally, when you're aroused, blood rushes to the vaginal tissues, causing them to sweat and produce lubrication. With lower estrogen levels, this process becomes less efficient. What used to take 30 seconds might now take several minutes, or might not happen adequately at all. I also want to address the pH changes that occur. Your vagina naturally maintains an acidic environment, typically with a pH between 3.8 and 4.5, which helps prevent infections. But during menopause, this pH can rise to 6.0 or higher, making you more susceptible to urinary tract infections and other complications. Here's what I want every woman to watch for. These are the signs that your body is asking for attention. Physical symptoms include dryness that you notice even outside of intimate moments, itching or burning sensations, pain during penetration, bleeding after intercourse, and a feeling of tightness or constriction that wasn't there before. Urinary symptoms are also common and often overlooked. You might experience increased frequency of urination, urgency, or recurring UTIs. Many of my patients are surprised to learn these are connected to the same hormonal changes affecting their vaginal health. Emotional and relationship impacts are just as real. I've had patients describe feeling disconnected from their partners, experiencing anxiety around intimacy, or even questioning their femininity. These feelings are valid and more common than you might think. One mistake I see women make repeatedly is assuming this is just something they have to live with because they're getting older. Another common error is trying random over-the-counter products without understanding what's really happening, which can sometimes make things worse. I also encounter women who are embarrassed to discuss these symptoms with their healthcare providers. In fact, studies show that only about 25% of women experiencing these symptoms actually seek medical help. This breaks my heart because effective treatments are available. Some women try to self-diagnose and assume they have infections when the real issue is hormonal. Others stop being intimate altogether, which can actually worsen the problem because regular, comfortable sexual activity helps maintain vaginal health. The key thing to remember is that these changes typically don't happen overnight. They're gradual, which is why many women initially dismiss early symptoms. But recognizing them early gives you the best opportunity to address them effectively. In our next chapter, we're going to discuss exactly what you can do about these changes, including both medical treatments and lifestyle modifications that can significantly improve your comfort and quality of life. Now that we understand what's happening in your body, let's talk about the exciting part, what you can actually do about it. And I want to start with some really good news. You have more options today than women have ever had before. When patients like Sarah come into my office, the first thing I do is listen carefully to their specific symptoms and concerns. Every woman's experience with menopause is different, and the approach needs to be personalized. Let's start with when you should seek help. Don't wait until symptoms become severe or start affecting your relationships. If you're noticing persistent dryness, discomfort during intimacy, or urinary symptoms that are new for you, it's time to have a conversation with a gynecologist or your primary care provider. During your appointment, be prepared to discuss your symptoms honestly. I know it can feel awkward, but remember that your doctor has these conversations multiple times every day. We've heard it all, and our job is to help you feel better, not to judge. The diagnostic process is typically straightforward. I'll usually perform a pelvic exam to assess the vaginal tissues visually and check for signs of atrophy. Sometimes I might test your vaginal pH, and occasionally we'll do hormone level testing. Those symptoms are often more telling than blood tests when it comes to vaginal changes. Now, let's talk about treatment options because this is where things get really promising. Hormonal treatments are often the most effective approach. Vaginal estrogen therapy is considered the gold standard for treating vaginal atrophy. This isn't the same as systemic hormone replacement therapy. We're talking about low-dose estrogen applied directly to the vaginal area. Options include estrogen creams, tablets that you insert vaginally, or estrogen rings that are placed in the vagina and replaced every 3 months. These treatments work by directly restoring estrogen to the vaginal tissues, helping them regain thickness, elasticity, and natural lubrication capabilities. I want to address a common concern I hear. Dr. Williams, I'm afraid of taking hormones because of cancer risks. The important thing to understand is that vaginal estrogen is absorbed minimally into your bloodstream. We're talking about tiny amounts compared to oral hormone therapy. For most women, the benefits significantly outweigh the risks, but this is always an individual decision we make together. Non-hormonal options are also available and can be very effective. These include vaginal moisturizers that you use regularly, not just during intimacy, to help maintain tissue hydration. Think of these like daily face moisturizer, but for your vaginal tissues. There are also longer-lasting vaginal lubricants specifically designed for women experiencing menopausal changes. These are different from regular lubricants. They're formulated to last longer and provide better comfort for sensitive tissues. A newer option that's showing great promise is vaginal DHEA, progesterone, which is a hormone that gets converted to estrogen right in the vaginal tissues. This can be particularly good for women who prefer not to use direct estrogen therapy. Lifestyle modifications can make a significant difference too. Regular sexual activity, whether with a partner or through self-stimulation, actually helps maintain vaginal health by promoting blood flow to the area. I tell my patients, Use it or lose it applies here, though always prioritize comfort and never push through pain. Staying well hydrated helps your overall tissue health, including vaginal tissues. Avoiding irritants like harsh soaps, douches, or heavily fragranced products in the genital area is also important. Let me bust some common myths I encounter regularly. Myth: this is just part of aging and I should accept it. Reality: while hormonal changes are natural, suffering through uncomfortable symptoms isn't necessary when effective treatments exist. Myth: coconut oil or other home remedies are just as good as medical treatments. Reality: while some natural lubricants can provide temporary relief, they don't address the underlying tissue changes that medical treatments can help with. Myth: if I use vaginal estrogen, I'll gain weight or have other hormone-related side effects. Reality: vaginal estrogen is absorbed minimally and doesn't typically cause systemic effects. Myth: these problems mean my sex life is over. Reality: with proper treatment, most women can return to comfortable, enjoyable intimacy. Here's my practical advice for taking action. Start by tracking your symptoms. Note when you experience dryness, discomfort, or other changes. This information will be helpful when you speak with your healthcare provider. Don't be embarrassed to bring this up during routine appointments. You can even mention it when scheduling. I'd like to discuss some menopausal symptoms I'm experiencing. If your current healthcare provider dismisses your concerns or seems uncomfortable discussing these issues, it's okay to seek a second opinion. You deserve care from someone who takes your comfort and quality of life seriously. Consider starting with over-the-counter vaginal moisturizers while you're waiting for your appointment. These won't solve underlying hormonal issues, but they can provide some immediate relief. Remember that finding the right solution might take some trial and adjustment. What works perfectly for one woman might not be ideal for another, and that's completely normal. Most importantly, don't give up. I've seen countless women go from feeling hopeless about these changes to feeling confident and comfortable again. You deserve to feel good in your body at every stage of life. As we wrap up today's discussion, I want you to remember the most important points. The vaginal changes you're experiencing during menopause are completely normal, they're not your fault, and most importantly, they're treatable. Whether you're dealing with dryness, discomfort, or changes in intimacy, you have options. From hormonal treatments to non-hormonal solutions, lifestyle modifications to medical interventions, we have more tools than ever to help you feel comfortable and confident. If this video helped you understand what's happening in your body, please hit that subscribe button to join our VitalHer community. Leave a comment below. I read every single one and love hearing about your experiences and questions. And please, share this video with other women in your life. So many women suffer in silence with these symptoms, and sharing knowledge can truly change lives. Thank you for trusting me with this intimate topic and for prioritizing your health. Remember, you deserve to feel good in your body at every age and stage of life. Until next time, take care of yourselves, and I'll see you in the next video. Dr. Mary Williams, signing off from VitalHer.